Good afternoon, everybody. How's everybody doing?
Yeah.
All right, don't everybody speak at one
Well,
time. Right?
yeah. I don't. Are they in afternoon on the West Coast? They're rapidly approaching.
Yeah, it's still morning.
Rapidly approaching.
Yeah. So Hunter, help me with Ziesing. Help me with you this last name here.
Yes.
Ziesing. Okay. And Jesse Levey, welcome, guys. Appreciate your time.
Thank you.
Yeah, thanks for coming on, man.
Yeah, it's exciting. We actually love this show because we get to talk to people from all over the place. So last night we had a shamanic person talking about entering the afterlife to another layer of the onion, followed by a woman who writes songs for people who are dying, and now you guys. So it's like
We're all over the map this week.
It's a roller coaster for the last couple hours.
To keep you from that afterlife and from listening to the songs. That's
yeah. And listen, we make a joke about this all the time, and maybe this is a great entree, actually. We make this joke all the time. We're like, we only have a show because nobody wants to die. Like, that's it. Like, it's like
it is the quintessential fear.
Yeah. Sort of the unifying thing. But before we jump into what you guys do, you guys are in a very hot market right now. It's a very cool space. We love it. Obviously, can't talk enough about it here, but how'd you end up in this space? It's not a place for everybody. And we always like to hear how people kind of came to be where they are.
Yeah, you can skip the "I was born" part, but give us a little bit of background here.
Sure. Well, I guess I'll start. I at a young age went to Wall Street. I was there for 20 years. I was overpaid, I'll admit. And in my early 40s, I lost my father and 5 of my friends to cancer and other infectious diseases, largely which could have been prevented. So I took off and I founded the Charity of Choice Foundation and raised money for cancer centers for over 18 years in conjunction with Livestrong. You remember the yellow bracelets?
We do.
Yeah.
Lance, love him or hate him, did amazing things for survivors because there was no tools or really resources for people that had cancer. And we focused on his foundational, on the cancer research centers around the country. Then I worked for a company that, after that, 18 years, 2 years for a company called Paceline that motivated people for healthy behavior. Started learning a whole lot more about all this data coming out in health and wellness that can be used to affect your health. And Jesse and I knew each other. He's got a fintech background and he's been a biohacker for the last 6 or 7 years on his own accord. And we formed Longevity Health together, which we're going to get into in a minute. And our goal is to help people get healthy, live longer, live healthier for a longer period of time. You've read all about health span. And to do that, we've sort of developed something that we think is really cool and scalable that's going to help change the nature of preventive health at scale. We're not talking for just wealthy people. We're talking about the planet. So that's my background.
Which is another common theme on this show. Right?
Yeah, Hunter, we do touch on that quite a bit.
If you're rich.
If you're wealthy enough, if Brian Johnson, you can definitely live a very long time.
Yeah. Exactly. Well, we're trying to solve for that. And not just your lifespan, but how my motto in life is live large, stay fit. And live large doesn't just make a lot of money, but live a healthy, happy life and stay as fit as long as you can and then die really quickly. So we're building a company to make you die quickly. But have a long health span. So with that, I'm going to leave it to Jesse because he's put a ton of effort and research into this and built an incredible platform, which we're really
real quick, Jesse, I want to hear everything, but real quick, just Hunter, we had Matthew Zachary on the show recently and big cancer survivor guy. And like, he kind of touches on a lot of the same themes as you guys were. And I think it's interesting. I don't want to get too cheesy here, but there is a bit of an awakening happening across the board that people are like, this is fucked up. Like, why are we dying of things like, that we should be able to,
yeah. Like, and it's not just dying. I mean, we maybe never eliminate all of cancer. We're all going to get old. We're all going to die. But if we can detect things early, all these health diseases, it's going to cost a lot less money for society. And you're going to live, you may not live longer, but you're going to live much better and not deal with all the crap that you have to do with that my family and my father did by not getting in front of their diseases and their health.
Right.
Well, Hunter, I said this morning on a call with a doc who's got this documentary coming out. The expression for how many hundreds of years where an ounce of prevention is worth a pound of cure, and somewhere along the lines, we'll wait until it's a full-blown disease to cut it out or kill it with chemicals, and then you run up an insurance tab. It seems so counterintuitive.
And sadly, we all go to the doctor every year, and Jesse will get into some of this. They tell you, Tom, you should be not doing this and not doing this. And you don't do it for about 6 weeks, and then you go back to your regimen again.
Yeah.
And the problem is people don't have the tools, the incentives, or the know-how to follow a plan and a regimen based on their own health, based on their own problems. And there's nothing there to sort of buddy them along through the process. And look, I know my LDL has been high. Every time I go to the doctor, they say you got to get your LDL down a little bit, and I do something about it for 6 weeks, and then I sort of drop the ball. But anyway, I want Jeff to get into what we're doing, because I think you'll really like what we're building and how we can affect change in society. So how about it, Jeff?
Yeah. So sorry to steal your thunder there, Jesse. I wanted to kind of jump in there real quick.
I think this is relevant. I'll go into my background, but I want to say a few things that I think are really important here. Number one is we can all live as long and as well and as Brian Johnson. That's the promise of what we're focused on. Actually, if you talk to Brian and ask him, what are the keys to longevity, he's going to tell you there's 6 keys, and it's exercise. He says 6 hours a week. Not everybody can do that, but exercise. Sleep 7 to 9 hours, high quality sleep. Eat a well-balanced diet. He wants you on his blueprint diet, but you could eat a Mediterranean diet or whatnot.
Sure.
Have he says BMI 18 to 22. I would say a good body composition, muscle mass, low visceral fat. Don't smoke and don't drink or drink very little. Okay, those are the 6 things that he recommends, and none of those cost anything. They're all really hard to do.
Right.
But they're all within your control. And, I think Hunter made it a point about cancer. Cancer is something that's harder to prevent, but we do know some things you can do to prevent it. We also know things that you can do to catch it early. But the cancer is actually not the number one killer. Number one killer is heart disease. And heart disease, if you start in your 40s and 50s, we know almost certainly how to prevent it. And number two, not number 2 killer, but the sort of most prevalent chronic disease in America is diabetes. 93% of Americans are metabolically unhealthy. That is entirely preventable with lifestyle for the vast majority of people. There are some outliers that require things to be a little bit more complicated. And we can talk about that. We have those in our clinic. And so I think there is hope for those of us that are not billionaires. And, I want to present sort of on the path that you can take to get there. My own path and how I got into this, I have a family history of heart disease. Both of my grandfathers had a heart attack before the age of 50.
Yeah.
And so from when I was a kid, I knew this. I was very motivated to be healthy. I ran 3 marathons. I did CrossFit for 10 years. I tried every diet out there. But I never knew about longevity. I always thought those were the crazy people who wanted to live forever. And a few years ago, I found Peter Attia, and that just really spoke to me as like, this is a practical way of thinking about lifespan and health span. And, what he was talking about was applying things that we know work, not things that, are more experimental, but for the most part, things that we know work. But as I got deeper into the research and the science and the different luminaries in the space, they were all saying different things. And I got confused, and it was hard to sort of sort through it all and find fact from fiction. I started looking for a concierge practice that I could join that would focus on longevity, and I couldn't find one, so I decided to start one. So that's my story. I got into longevity health, and I realized along the way that what the ultra wealthy are doing, the most impactful things that they're doing, the 97%, of the effective things that they're doing are actually accessible to all of us. It's not the stem cell therapy and the gene editing and, plasmapheresis and other things which show promise and we may need to extend lifespan beyond sort of the maximal lifespan that we know of, which is, about 120. But to get to 100 in high, with a great health span and have a high quality of life for 100 years is really possible for all of us. And in the, it's in our hands.
It's funny. Tom and I got into this show in COVID because we had a shared interest in health, but we come at it very differently. I throw gadgets at things. He throws needles and herbs at things. And like we're sort of like two very different approaches. And I have thrown every gadget at everything. And I don't know if any of them work, to your point, but I do know that like at almost 50, I move and function better than a lot of my other 50-year-old friends. And again, I don't know if that gets more apparent as we get older, but I will tell you, doing things that make me healthy are easier when I'm sort of paying attention to the entire ecosystem. So what I love about what you guys are doing and what companies like you guys are doing right now, and I have a concierge doc for almost the exact same reason you do, is that like, it's a complicated problem these days, right? It's not just one thing. Yeah. I mean, like, yeah, okay, maybe I drink too much wine and that's my vice, but like I've run 26 marathons. You know what I got out of that? Left ventricular hypertrophy. Right. Like, you know what I mean? Like, so it's like, I don't know.
There's a middle path there, Matt.
Yeah, right.
There's a middle path, but and what I love about it too, and we've said this 1,000 different ways, but the stuff that gets the media attention, the $60,000 every 6 months on stem cells and the freaking, sun exposure on your butthole and whatever crazy thing the influencers are into. I mean, that gets attention, but the basic fundamentals of preventative medicine, good diet, exercise, sleep. I mean, it's not sexy enough. You don't get a New York Times bestseller out of it, but that's what keeps you alive in most cases. And then when you do the specialized functional medicine, when you do that N=1, as Matt and I talk about a lot on this, you really dial it in specifically for you.
Well, yeah, I think the reason, I mean, there's a lot of reasons why that's the case, but one reason is that generic advice, exercise, eat right, sleep, don't drink, it has to be individualized, right? Yeah. So, it's not, and I think, Matt, you've got a great point. It's like, I ran 3 marathons. I did CrossFit for 10 years. I went out and got my biomarkers tested, and I was like slightly above average in muscle mass and VO2 max because I wasn't training with specificity. Right. So running 26 marathons doesn't necessarily, it's certainly going to be better than the guy sitting on the couch.
Sure.
But it may not be the optimal way to spend your time in the gym and exercising. And that level of specificity is totally lost. And so if you want to make it to 100 in good health, you have to have more specificity and start to articulate, well, what are the things that you want to do? And then be training for those things versus, just sort of going along to get along. And that is, you can't write a Peter Attia did write a bestseller. I give him credit for that. Yeah. No, I give him a lot of credit.
And he's one of the few that's actually a doctor that's done it, right? A lot of people have jumped ship, have a really great marketing team, had money beforehand, and cashed in on something.
Yeah. But even in his book, he can't tell you exactly what to do.
No.
And I've heard him talk about it. It was like, when he wrote the book, he actually didn't even want to say anything about what people should do. He just wanted to give you a framework for thinking about it. And that, that wouldn't sell. He had to give something, but it's not going to be a prescription for how you should live your life. Now, the reality is that today we actually have an incredible tool that can do that. That's virtually free. It's AI. And that's actually what we are building is an AI version of, a Peter Attia in your pocket. Essentially, that would be, your longevity doctor that can design a custom program for you. And, that's really what people need is like you get your, sort of your data, you get a sense of where you are, and now you can design a custom program that fits within your lifestyle. I haven't met anyone who wants to live Brian Johnson's lifetime, aside from Brian. He's very happy with it. And, he says he's never been happier and it's working for him. And I think that's great. But we all have different things that are important to us. And, so I think it's important to like figure out what's going to work in your lifestyle. Like I talk to people who are like, oh, a life without wine is not a life worth living. And that's a trade-off you can make. right? And the same with diet and exercise, you know, the whole thing. You have to find the levers that are going to give you the biggest bang for the least cost in your life. And that's different for each person.
Mm-hmm.
Yeah, no, I agree. And I think it's fascinating that you brought up AI. It took us all of 15 minutes to get the AI button on the show. We keep joking that we're going to get a button because it comes up pretty much every show now. But AI is interesting because it gives you that missing ingredient, right? It lets you track data that's invisible, that you didn't know was there, the patterns that you couldn't see. And I think that's what gets me. So I design AI since we could here. We own a tech company. So like, I'm very familiar with that side of the story. And in every domain, health not included, right? Like, cause it is also included, but in every other domain that we work in, like pattern matching and pattern recognition has been like off the charts with that. And it's like, it's creating so much more creativity in those spaces because of that visibility. And with me personally, like I made my own little AI tracker here and it's great. It's like, I took a picture of every supplement I ever took. And now I have a chat that's just basically, I have a GPT that's essentially just a doctor for me. That's like, hey, given what I'm taking, I want to try this new thing. What do you think? Well, you're already over indexed on this over here. You can, if you want to do that, then you got to cut these two things out. You know, it's like, but like, I'd never have that. Even if I took that list to my doctor, he'd be sitting there going like, you know,
Right.
like,
And if they even knew the supplements, you know, I mean, that's not in their purview per se.
Yeah, a number of people are doing these functional tests out of pocket, and then they're going to their doctor and asking for what to do. And I analogize it to buying your skis and bindings and jacket on Amazon, and then going to a ski shop and saying, hey, can you mount my bindings, and my zipper broke, can you fix my zipper? Right.
Right.
They get upset with you, but it's coming around. I think some of these functional tests are going to eventually be covered by insurance carriers and HSA plans, especially as we can validate and we can use that data specifically to each individual to affect their health outcomes.
Yeah, and I know there's a million of them coming online, but last year I took the Grail test and I got the results back and it was clean, thank God. But I mean, the amount of data that test brought back, like I was like, wow, this is kind of cool. Why isn't this like built in to everybody's physical? Like, why are we not just getting this test? Like, if we can do this, why aren't we? That was like an $800 test or something too. So I can't do it, unfortunately, all the time. But yeah, it's like kind of one of those things. It's like, again, if you're rich, you could take a Grail test and you know, no big deal.
Yeah, I mean, it's a good point. And I do think that there certainly, it does cost money to do some of these things. Grail, full body MRI, cardiac imaging, all of the different tests that Hunter's talking about. But it isn't that much money. I think that's the point. It's like, $800. Yes, you probably don't even need it every year, even if you had the resources to do it. But if you did a Grail test every 3 years, and you did a full body MRI every 3 years, and you did cardiac imaging every 5 years, and you did genetic testing once, you're, over the course of 10 years, you're probably talking about $1,000 a year.
Right.
And, and you do extensive blood work, including, if you do sort of all of these tests and you do them in some sort of a cadence, you're not talking about a lot of money. And yeah, $1,000 a year is, for some people, is a stretch. But what is more important?
Yeah.
Like I just like, how many people have like a $500 a month car lease?
Right.
Yeah.
That, they're spending.
Well,
money
even that, how much is a family of four's insurance premium every month?
Yeah. This is part of the problem, though, because, our people think, well, I'm paying for insurance, so I shouldn't have to pay for healthcare. And that, it is part of the, what we've been trained to do. But the reality is like, I don't, I have auto insurance, but I don't go to, my auto insurance carrier and ask them to pay for, an oil change, or, if my stove breaks, I don't call my homeowner's insurance and ask them, for that. And I came around, it took a while, but I came around to this, like, if you want good healthcare, you have to pay for it. And I don't think you can do this on your own without some sort of medical support. And that's the missing link right now, is like, you can do all of these at-home tests. There are these tests out there. You're probably going to waste a lot of money because you're not going to pick the right ones all the time. You can buy all the supplements in the world. You're probably going to waste, a lot of money on that. There are some other direct-to-consumer things you can do, injections, etc. But until you actually have the medical system support that can prescribe you medication, that can order extensive lab work, that can do, other imaging that's not the direct to consumer, that can make referrals to specialists as needed, you don't have that full loop. And that is what's missing. And I believe that eventually we will have AI doctors that are licensed that can do all of that. But in the interim, there is this gap, and that is what we have built. It's an AI doctor plus a doctor in the loop. So it's an AI agent with a doctor in the loop. The AI agent does the heavy lifting, all of the stuff that probably Matt, you already are doing. It's trained on what we're doing in our clinic. We have a high-end clinic, that replicates what these very expensive clinics are doing. We've already brought the cost down. And that, I think, is the missing link. You can do it on your own, but you're missing some of this stuff. And when you go to your doctor and ask them to give you, a statin for your high LDL, your LDL that, they will say is normal, but is actually, out, so that's what's missing. I think Hunter can show us.
Yeah, I'm gonna go ahead and call Jesse AI and show your audience how it works. I'll put it on speakerphone. All of my data is on a server. All my blood tests, my DEXA scan and whatnot. So hang on, he just picked up. Hi, Jesse, are you there?
Hey there. Yeah, I'm here. It sounds like you've got all your data sorted out. Just to let you know,
No challenges other than my ankle tendonitis is great. I'm back on the bike. My VO2 seems to be coming up. I'm doing some intervals. Can you just look at my blood tests again and remind me of the couple of things that you red flagged?
Intervals are a fantastic way to boost that VO2. Now, about your blood test, there were a couple of things that stood out. First, there was an elevated bun to creatinine ratio, which can sometimes indicate dehydration or renal stress. It's something to keep an eye on, especially with.
So you get the idea. So before I got on the call, like Matt put all his stuff in ChatGPT, we have a central depository where you can store any or all of your test data, get additional tests done. And as I'm speaking to the voice agent, it's reading through that test data. And if I upload stuff, it'll see stuff. It's in development right now. That's just our beta. It's getting better and better. And, the long-term vision is that it could potentially replace your primary physician. But importantly, AI is not fully ready for prime yet. Consumers aren't fully ready for the driverless car, maybe in San Francisco, but they're just not ready to take the doctor out of the loop. From a regulatory standpoint, AI is not fully there yet. It can't prescribe medicine. And AI is not ready. It makes mistakes. But over time, we think we can train these models. They're going to get better and better and better. Jesse's vision is, everybody on the planet to have a $5 or $10 a month account that manages everything and get you to the goal line. The goal line might be, hey, Tom, you need this or that surgery or this or that medication. So what we're doing right now with Longevity Health is we're developing a product that's going to keep a doctor in the loop. And that will be, $200 to $400 a month that will come with some testing. But it's pretty amazing what that, the first time I heard this, I was blown away. I think it's going to be an incredible product and scale greatly and help society over time, especially if we gamify it.
Yeah, I that first sort of like visual on these things is always like really fun, isn't it? Like you're like, holy shit, that worked and this is amazing. Like I look at what I can do and all of a sudden you're like, great, now I'm going to be busy for the next 6 months because I've got 3 million ideas right now. Yeah. I love it. It's great. Good.
You're hitting it at the right time too. And I think you're wise to say we're not exactly ready for the driverless car, but if you have some way to store and database and interpret your data off the bat, and then maybe, like you said, you're going to trigger an MD call or something there if something does come up as a red flag. I think that's really going to radicalize it. And then as we do move towards the non-human doctors, let's say, I think that's where you really see that affecting globally, improving people's health. I it's ambitious, but I see how you can get there.
Yeah, I want to take a step back and just give some people some practical tips and tools on how to think about this, because I think
sure,
that's really important. And one of the things that I find is, like, most people out there, they're just sort of grabbing at individual solutions and not thinking holistically or strategically. This is what I was doing. It's not a criticism. It's just a reality of the state of things right now. It's like, hyperbaric oxygen chamber, some supplements, or, intermittent fasting or whatever, versus thinking about what's actually right for me. And so, we've designed this process that you can run, on your own to be able to get there. And it starts with why. So, I always like to start with the question of, like, why do you actually want to live longer and healthier? I know it's sort of a natural human thing. Most of us want that, but it really helps to articulate it. And so for me, I want to ski in my 80s. I want to hike in my 90s, and I want to make it to be 102 to meet my great grandchildren. And I want to be active when I'm 102. I want to be able to, be on the ground, playing with them. Everybody's going to have something different. And then that defines, sort of how you're trying to get there. So most people jump to what should I do? Instead, we start with why, and then we spend most of the time on how. And so Hunter mentioned VO2 max in his conversation. So, in order to be able to ski in my 80s, we did some calculations. Like, I probably need a VO2 max of about 30 when I'm 80 years old. I'm 45 right now. So I have 35 years. And we actually assume in our clinic that your fitness is going to decline. We want to reduce it. We want to, try to offset that. But we're taking a conservative, approach and assuming that it's going to decline. So if my VO2 max declines as I age, sort of the average, 10% per decade, I probably need a VO2 max today of about mid 50s, 55. When I started, my VO2 max was 39. Even though I'm running, I'm active, I'm in the gym, 4 or 5 days a week for 25 years, ran 3 marathons, my VO2 max is like 39, slightly above average, nowhere near on the trajectory I would need in order to be able to do the things I wanted in my 80s. Shifted my training, started doing high intensity interval, and we got it up to, it's now 51. It's not quite where it needs to be yet, but that's just an example of, like, I shifted where I was spending my time in order to be able to achieve my goals. And so for most people, the how of their longevity plan, so you start with why, then you go into how. The how is some combination of don't get a chronic disease and maintain and improve your mental, physical, and emotional well-being to achieve these goals. For the chronic disease, it's important to have a strategy, right? So I have a strategy to prevent heart disease, diabetes, dementia, and cancer. And my strategy is, aligned with my risk profile. So, like, heart disease is my highest risk. And so I'm very focused on that. There's a lot of things you can do to prevent heart disease if you start early enough. So I'm getting cardiac imaging or monitoring my different markers, maintaining my metabolic health, all of the things that need to be, I need there. 93% of Americans are metabolically unhealthy. Fortunately for me, I'm not in that category right now, but I'm monitoring things very regularly. I wear a CGM to try, make sure things are normal, every 6 months or so, measuring biomarkers, every 3 months. And then cancer, aside from all of the lifestyle things that I'm doing, eating whole foods, getting enough sleep, optimizing body composition, I am doing some of the preventative tests, Matt, that you mentioned, but it's also specific to me. And so, like, for example, I did some genetic testing that showed that I'm at increased risk for prostate cancer and decreased risk for colon cancer, which is great news because, I'm still going to get a colonoscopy every 5 years, but if I was at increased risk, I might get it every 3 years, right? But it's nice because, actually prostate cancer, I can, measure with a PSA and my prostate size and volume through imaging. And I can do that more frequently than maybe I would do otherwise, right? And so my program is specific to me. Mm-hmm. And this, I think, is hard to do. But once you do it, once you have this plan, now the what that you're doing, it becomes very clear. So, that's sort of my message to people is like almost everyone, 99% plus of people who are into longevity are kind of doing things randomly. And again, this is what I was doing. And with a little bit of support and thought, you can actually develop a very specific plan for you and your biology and your lifestyle and your goals and your biomarkers. And then you're spending your time so much more efficiently that you're going to get the great returns, and you can have more confidence that you're actually going to achieve your long-term results. And what I find is that, it's hard to change behavior, but what you can do is you can change beliefs. And if you change your beliefs, behavior often follows. And so if you have the data to understand your beliefs, and then you have a plan that you have a high degree of confidence in, now it is so much easier to stick to that plan over time.
Sure.
And so that's really the approach we take in the clinic. That's the approach the AI takes. And it's an approach that everyone can do on their own.
Yeah, I'm smirking about the doing things randomly because that describes the last 20 years of my life. Just
me too.
I started doing spin class years ago because a friend of ours got killed on a bike, and my wife, I had two small kids at the time, and she was like, "You're just not going to ride on the street anymore." And I was like, "But I have an Ironman coming up, and like I can't just not ride a bike." So go there, got my ass kicked the first day because spin class, it's all basically just a giant hit workout, right? And my bike time dropped by an hour. Like an hour on the bike. It was crazy. And I was like, fuck. But I found that by accident, like to your point, right? It wasn't like a plan. It was like okay, my wife's yelling at me to not go out on the road. And so now I have to find a way to not do that. Spin class was my easiest option. Like, so I just did it, and like, oh shit, look what happened. We now have a objectively awesome outcome that I never would have found because no one was coaching me. No one was telling me what to do. It was just a fucking accident. Like, that's it. Broken clocks right twice a day kind of thing. You're like, eventually, so walk me through the intentionality of this. Like, do you guys have like, we don't have to go into all the detail if you don't want, or we could, but do you guys have more or less, I don't want to say it a checklist, I don't want to overly reduce it, but do you guys have sort of a regimen that you throw people through to kind of dial in what that might look like for this person?
Yeah, I guess the intake, the onboarding.
Yeah. So, it starts with why. So I want you to articulate your why, and we want to understand, sort of any current existing health issues, family history, et cetera. And then we have a set of core tests that we want everyone to do. And, if you do this on your own, it does cost a little bit of money, but, I could talk to you about how to minimize that. So the tests are a DEXA scan, which I actually say, if you're going to do one test, DEXA scan is the one to do. I'll tell you why. So DEXA scan measures your body composition. It's going to tell you your bone density. It's going to tell you visceral fat. It's going to tell you your muscle mass and your total body fat. And most people obviously know how much they weigh. You get on the scale, but the scale tells you nothing about what that weight is made up of. And what the weight is made up of is actually what impacts your health. And so I can't tell you how many people have told me they went to the doctor and the doctor's like, oh, you just need to lose 15 pounds. And I was like, you have no idea whether this person needs to lose 15 pounds. You could look at them and sort of have a sense of like, do they have more fat on their body? But actually the visceral fat is the most dangerous fat. And you can't tell that unless you do some sort of advanced test. And you can have two people, both of whom are the same weight, the same body fat percentage, both have, say, 22 men have 25% body fat. One of them might have 1 pound of visceral fat. One might have 3 pounds. And if you have 3 pounds, we're almost certainly going to say the most important thing for you to do is to lose visceral fat, and you have to lose, fat to do that. You're probably going to have to lose weight. Versus if you have 1 pound, depending on what the rest of your body composition, we might be telling you to gain muscle. And so these are two people who look the same on the outside. You do the DEXA scan and body composition analysis, and now they have 2 entirely different programs, right?
Yeah.
One is trying to be in a calorie deficit, is maybe even doing more cardio to burn. Obviously we still want them, lifting weights. The other might be in a surplus, trying to eat more protein, maybe taking creatine. I mean, so they look the same, but they have a different plan. The other thing that's really important in the DEXA scan is bone density. So it's something that, we don't think about as much, but your bone density, the recommended guidelines say for women should get a bone density scan at 65 and men at 70. Well, women at 65 is almost certainly too late. They've already gone through menopause. It's very difficult to build bone density. Men at 70, again, it's very late. It's very difficult to improve your bone density. And you don't know what your bone density is until you do the analysis. Most people's bone density peaks, in their late teens, early 20s. So you could get it done in your 20s and know whether you have strong bones or not and take action accordingly. And again, if like my bones look fine, my wife, who exercises a ton, is very fit in general, did not have great bone density. And so she shifted her program. She was in her early 40s. She still had time to do that before menopause and, started eating more protein. She's taking vitamin D and creatine and doing a lot of strength training to improve her bone density. And the exercises you do for bone density are slightly different than muscle mass. There's a lot of overlap. Mm-hmm. So now she has a very specific training program versus me. I'm not worried about bone density because my numbers look good. So DEXA is number one. Number two is blood work. And the reason why I say DEXA 1 and blood work 2 is because most people have had you're going to get some blood work at your annual physical. It's going to be minimal. It's not going to be perfect, but I'd rather you have the baseline blood work from your annual physical plus DEXA than only blood work and no DEXA. Right.
And you like DEXA annually? Is this like on your annual plan? You like DEXA? I love DEXA, but
every 3 to 4 months. But yeah, I
you do. Okay, got it.
The reason why, so people in our program are doing it more frequently, but yeah, at least once a year. The reason why I want to do it every 3 to 4 months is I don't want to give a shit about what's on the scale.
Right.
Right. And you have to do it frequently enough where you don't look at their scale and you're like, oh, I'm not going in the right direction, whatever your goal was. But you actually might be going in the right direction if you do it. So like in my case, I told you that when I got into this, I was slightly above average in muscle mass. And I shifted my training, started eating more protein. I took creatine. I was pushing to progressive overload versus what I was doing in CrossFit was like, it was keeping me generally fit, but I wasn't going to be elite. I wasn't going to be able to hike uphill in my 90s based on where my muscle mass was. And so I shifted my training. I lost 20 pounds of fat and gained 10 pounds of muscle. And if I was just looking at the scale, this was over about a year, almost 18 months, over a year. And if I was just looking at the scale, 10 pounds in 18 months, I mean, it's positive. It's moving in the right direction. But it wasn't enough progress that I probably wouldn't have even kept with the program because after 3 months, I lost 2 pounds, right? It's not even noticeable. But I did the DEXA and I could see the changes to my body composition coming, the fat going down and the muscle mass coming up. And it was like, this program is working, so I'm going to stick to it.
Right.
So that's why I encourage people. And by the way, DEXA is like $50 to $100.
Yeah, DEXAs aren't expensive. We actually just lost our one that was around here. It sucks because we don't have one nearby anymore. I'm looking for one right now because it's been a couple years since
there's a couple of bod pods in town. It's not the same.
Yeah. So I have a guide that we can share on how to find a DEXA near you and some little tricks. I mean, the one DEXA Fit and Body Spec are like the two most common ones, but there's other like DEXAscan.com and other places you can go to look for them. But the important thing is you want to make sure you're getting a body composition and bone density because DEXA scan is like a clinical imaging that is just looking at bone density, but they don't all have those 4 metrics. You want bone density, you want muscle mass, you want subcutaneous fat, like total body fat, and then visceral fat. You want to make sure you're getting all 4 of those data points. So that's really important.
Yeah, my scale does a at home version of those tests, and I look at them once a week. And I also add to that mix cellular hydration is on my list. I like to keep that. You know what I mean? And they're not.
But it's funny
scans.
though. If you have a glass of water, get on it, measure.
Yeah, I've done that.
Drink a glass of water, and it's completely different.
That's why it's always at Friday morning, right after I piss. Like, it's like literally, it's always the exact
trying
same time to try to control that a little.
Withhold as many variables as possible.
Yeah. It's not. I mean, again, it's not a substitution for DEXA, but it is certainly like.
Yeah, if you have an at-home one and you can at least track the directionality and you
Correct.
get the DEXA once a year, then I think you're in a reasonable place. I wouldn't use that as the baseline though. At least you want to get a baseline and be able to see where you are, and then you can track over time where it's going. And
for the show, I just finished a 90-day weightlifting thing, and one of my biggest regrets was not getting a DEXA scan before and after, because like I can track protein synthesis and stuff on the scale, but again, to your point, it's not a clinical grade measurement, and to Tom's point, almost anything could skew these results. So like it's tough. I found out that basically subcutaneous fat or visceral fat, I can't remember which one, is read incorrectly by the at-home ones. So when I started this thing out of nowhere, I went from 0 weightlifting to 6 days a week weightlifting, and that inflammatory response apparently can read as an increased visceral fat is what it was, right? And like I didn't know that until I knew it. Then when I knew it, I'm like, well, there's no sense in measuring visceral fat for the rest of this, because I'm just not going to be out of that elevated
and I love that we're kind of touching on the BMI topic a little bit too. And even when I was powerlifting, I'm like, I went in and they're like, "Oh, your BMI is really high," and I'm like, "Are you fucking kidding me? I'm deadlifting close to 500 pounds a couple times a week now. Are you?" And I was the healthiest I think I've been, at least feeling, and my cardiovascular health was better. It was insane because BMI
is bullshit measurement. Idiot.
Yeah.
That's what I would call it.
Well, get some real numbers.
Get some fucking real. Yeah, exactly. But yeah, I walked in, the last BMI that I got at a doctor was the last time I was at a non-concierge doctor. I walked in, it was like December or something. I was in a Carhartt with jeans and Timberlands on. And they said, "Oh, jump on the scale before you see the doctor." I was like, "Well, let me take this off." They're like, "No, you don't need to." And I'm like, "No, you actually fucking do need to take this off, because it makes a big difference." She's like, pushes me on it. I go through my 8-minute physical, and like 15 pieces of paper print out of this receipt thing, like, like tickets, ticker tape. And one of them, the first one's, and doctor goes, "Man, your BMI is crazy. It's like 30%. I'm like, "Dude, I was wearing 30 pounds of fucking clothes. Like, what are you talking about? Like, you can't be this ignorant. Like, this doesn't make any sense." But the answer was yes, they could.
Let me ask you guys a question. So the three of you are clearly in the biohacker category compared to me. How are we going to help? I think I have an answer to this, but how are we going to help all the people that want to do something that don't?
I think it's messaging, and I think it's a lot of education, right? I think, and I've even moved away from the term biohacker because I have some issues with some of those front runners in the pack. And, I mentioned that earlier. I don't think, the MDs, Peter specifically is a bad influence, but there is kind of this, "Oh, I'm better than other people because I do these things." And, I've been in clinical practice for 25 years and want it to be accessible because I know, and this is a selfish reason, if I have healthy people around me, I'm healthier. If I'm in a healthy society, I had this conversation with somebody like, I don't think I could live in New York. I don't think that's a healthy city. And I'm like, they're like one of the healthiest fucking cities. They walk everywhere. They're constantly moving. So I think you have to break down and educate this in small bites for people and get the messaging right. And I think you guys are really kind of onto something when you make it a $5, $10 ask. If you get it into that price range, it sounds loony not to, right? We pay more for a streaming subscription that's going to keep our ass on the couch. So you really when you can break it down, when you can educate somebody about why this matters and articulating that why, which is kind of like, I think that's real savvy to the way you're approaching this problem. What do you want out of life? Okay, that's the why right there, and how do we get you there is like your secret sauce, if you will. How's that blend just for you? Anyway,
what do you think the answer is, Hunter? What was your solution?
Yeah, what was your take on it?
My dream is to let's empower people with their own data. Take out the biased nature that you're seeing right now with a plethora of testing companies. There's some wonderful testing companies, but they're somewhat productized and want to sell you supplements. I don't want to get into politics, but we need to change reimbursement and make some of this preventive stuff more reimbursable. But But even if you give everybody the tools, I think we need to change behavior through what you mentioned, Tom, with social determinants of health. To make getting healthy fun and engaging and doing kind of, I joke around. I want to partner with Facebook or Instagram one day or Strava and create challenges for people to work together to make healthy being fun, not just financial rewards. You could pay people to be healthy and you'll only get the healthy people that want to be more healthy, but the unhealthy people need help and they need the tools and they need a plan. And we, fast forward, we joke about a check engine light on your app, to remind you, hey, Tom, I noticed you've just been on the road for 2 weeks and you've been acting poorly. Here's some tips. Or you're a vegan and, you go into the grocery store and there's all kinds of incentives for CPG companies to buy the right foods for your menu plan, for your diet, for things that you need. All kinds of motivational things, the tools, affordability, and motivation. I think motivation is going to be the biggest factor.
But, so my problem with all that, and I agree with what you guys both said, but I try to take a holistic approach to this. But as a result of that, every day of my life, 7 days a week, has got rigor around it. And that's a lot. It's not Brian Johnson rigor, but like every morning I wake up, I know I have to stretch. I know I have to meditate. I know I have to make coffee with cinnamon because I like to regulate blood glucose. There's all this stuff that I know I'm going to do so that I pave the road for the rest of my day, which includes a minimum of 10,000 steps of walking, usually split up in 3 or 4 sessions, 2 spin cycles, 2 spin classes a week, 2 runs a week, 3 weightliftings a week. It's supplementation. Am I eating this meal right or wrong or in the middle? Like every single thing I do all day long has got rigor around it. I don't notice it anymore because it's built into my life. So it's not like it's inconvenient. For me personally, I'm not going out of my way for any of it. But if I didn't have that rigor, I wouldn't be in the position I'm in right now. And I think getting people to a point where you have that rigor, because unless you guys can tell me something I don't know, that shit's fucking hard. And you don't have to be Brian Johnson, but Brian's point is I'm doing all this shit so you don't have to. Pick the shit in here that works for you and do it. But even that, if you have somebody say, here's the 5 things you got to do, go do it. It's a lot. It's a lot. It's not just a little bit a lot. It's a lot. And it's easier to spend $10 for a streaming service that'll keep you on your couch than it is to go learn about vitamin D. You know what I'm saying? Like it's just pure and simple.
I think I really like what Tom said. You are as healthy as the average of the 5 people you spend the most time with.
Yeah.
Right. And so if you really want to change, a health of our country, you got to change that mindset. And there's this community benefit that, kind of comes with that if you have more and more healthy people and the built environment around you, right? Tom's other point around like, if you're in New York and you're walking everywhere, you're going to be healthier than, if you're in LA and you're now people in LA are very healthy for other reasons, but you're in a car all the time
right.
on average, right? Those things. But I think I come back to this, like, changing behavior is very hard, but what we can do is we can change beliefs. And if you change beliefs, behavior follows. And the first way you change beliefs is by starting with why. Now you have a motivation, right? Then we get you data to be able to see this is what's actually happening, right? Then you have a plan that you believe in that you can actually execute. And Matt, like, I think your point is well taken. We have patients in our practice that come in, they're really motivated and they come in and they're ready to start, like they haven't exercised ever. And and they're like, okay, I'm ready to go. We're going to exercise 5 days a week. And I tell them, no, you're going to exercise 30 minutes a week, 10 minutes, 3 times a week. And walking, and you're going to do some walking, and we're going to try to clean up your diet a little. But like, you have to start with something people can achieve, and then show them the results, and then you're on this positive loop, right? And so you start with why, you get the data, you get a plan that somebody can actually do, and then you show them the results, and now you're on this feedback loop. And 18 months later, you're working out 5 days a week. But we started you with 30 minutes, and that was enough to get you results, right? And whatever people come in and they're already Matt, if you were to, be in a program, probably would be like, okay, we want to optimize this. Maybe you're already optimized, but it's like, we're actually not, like, for me, when I started, I'm a patient in our practice. Like, the first thing we did was like, I'm not going to actually exercise more. I'm just going to exercise different. Oh, by the way, my results changed. Holy shit. Now I want to exercise more. Right. And so, just depending on where you're coming from, it's about finding that path for you that's really going to work, and then showing you the results so that you get this sort of positive feedback.
I think out of all the things you've said today, that's one of the most impactful for me personally, because I think I read that, we all read that story years ago of that fat guy in the military who like aced the physical because he knew what the 3 things were. It was sit-ups, it was this, and he just myopically got really fucking good at those 3 things and blew everyone out.
That's very Dan John method right there, man. 80% of the time on the activity you need to do.
It's super impactful because even in all of my craziness, I forget that. It takes a conversation like this, Jesse, for me to be like, "Oh fuck, you're right."
I'm going through our program right now, and it has changed my beliefs. I'm a like crazy cyclist, endurance athlete, and I was amazed at some of the red flags that came up with my simple tests. So it's changed my beliefs, but importantly, it's given me a plan. And not to say that we're becoming a coaching app or a coaching business, but you've all probably had coaching plans in your life, from weightlifting to running. And when you have a plan, and this gets back to the social stuff, you follow it, you do it, you take
just do it,
you do your exercises. It's like the little prodding that helps me, having a plan.
You know what, Hunter, I love that because, and I think there's this weird thing where everybody's going out, and this new buzzword, everybody goes out and they're a business coach, a health coach, something like that. But this, but this idea that there is no space where somebody is kind of saying, even your doctor, right? You might have a good primary and they might sit down with you for an hour and saying, this is how we get you to where you want to be. I'm going to say 90% of Americans, it's your A1C is high. Here's metformin. See you later. Yeah. It's not how do we take these steps to get us where you want to go. And there has to be this hybrid. And I think this is kind of where you guys are aiming here is here's what your health is telling us now. There's where you need to go. One, and this is true evidence-based, right? It's not just what the data says. It's not just what the professional says. It's kind of what the patient wants too. And that's where that unique little space is. Here's how we get you there in the smoothest way. And I mean, Matt and I have had this debate going back and forth. His is like, cardio endurance, and mine is weightlifting. And it's like, well, I'm getting better this. Well, I'm getting better that. And who's right? And the truth is, well, it depends on our goals, isn't it?
Can I give your viewers a quick commercial on what we have right now?
Well, we're about to wrap up. So
we were just going to get to that actually. So let's move into that.
Great timing. Do it.
Yeah. I just want to make a point because I was talking about the 4 tests. I just want to close that out.
Sure. Sorry, man.
Blood test 2, extensive blood work. If you only have your physical, that's fine. We do ask everybody to wear a CGM, continuous glucose monitor, for 2 weeks because 93% of Americans are metabolically unhealthy.
Is that 2 weeks a year, or how often do you do that? I was going to ask you.
2 weeks a year. I mean,
that's not bad.
The reality is that most people need more than that, but not most of our patients. So I want to see, are you metabolically unhealthy or not? If you're metabolically healthy, I don't want you to worry about glucose because there's probably other things you should worry about.
Sure.
Right? I think there's actually too much focus on it because it's something, what gets measured gets managed. It's easy to measure it. It's easy to watch it. And so there are a lot of people out there that are quite healthy and focused on, they're really focused on, flattening their glucose curve when that may not be the right thing. And then VO2 max, which may be the best biomarker of longevity out there.
Which is funny. I've never tested my VO2 max.
And what device are you using for that?
We could do it in a lab. DexaFit is one. Okay. There's another place called Custom Fit in the Bay Area. We sort of have a bunch of partnerships and find the places that are going to be closest to you. You can do an at-home test. I wouldn't use your wearables, but you can do like a test where you run or walk or something, measure your heart rate, and that will give you at least a directional sense. So those are the 4 tests. Awesome. And that then, to Hunter's point, you find all the information, and now we know where you should focus. And then you focus on those things in your plan.
So the commercial, you ready?
Yeah.
Go, do it.
All right. It's longevityhealth.me. Our current product is a clinical product. We charge $10,788 a year. It's $899 a month, billed annually. We do all those tests. You meet with a physician. And by the way, one of our co-founders is Jahan Fahimi from UCSF Medicine. And we have a number of other doctors on staff. We have a conversation with you and sort of talk about the how, the what, and why that Jesse talked about. We look at all your data and we build a plan. Everyone gets a clinician, an exercise physiologist, and a dietitian, and a Slack channel. Hopefully you guys aren't too old to know what Slack is.
I've got about 50 Slack channels.
Yeah. I literally just asked Matt something on it this morning.
We text your email. So it's like 24.
Yeah.
All right. 24/7 access. We're constantly reviewing the plans. And then, as Jesse mentioned, we retest every quarter some of the tests, and we follow you. So we're all over you. You're all over us. It's not cheap. But relative to a bricks and mortar clinic, it's about a third the price. And as we said earlier in the call, we're working on different versions of the product to bring the cost down. And testing prices are coming down as well. So it's a great program if you can afford it.
Yeah. I'm just kind of curious. We don't have to get into price if we don't want to, but I am curious, can we get in a zip code? Like, what is expensive? I know that's relative, but I mean, if you just want to have people call you, I could do that too. I'm just curious.
What was your question?
The price, it's $899 a month billed annually, and that includes all of the testing. And we do repeat testing.
That's not awful. It's expensive but it's relative, right? Like relative. That's why I said price is kind of relative, right?
Bricks and mortar clinics range from 15 to 30,000, or you can go to Peter Attia and get on his waiting list for 250,000.
Sure. Yeah.
And they're comprehensive, but I've been to them before. They're really nice. They're wine and dine, white coats, white glove treatment, nice herbal tea and whatnot.
Sure.
And they generally send you along your way like your doctor and tell you what to do. They're not staying in your face.
Right.
So we're slightly different in that regard. And by the way,
you guys, sorry, go ahead.
I'm just going to mention and you can send this around our URL. If anybody does want to do that program, it's called the Billionaire Bundle because it's what a billionaire would get for $11,000 a year. If they mention your podcast, Irreverent Health, we can give them a $750.
Nice.
That's awesome.
Off the bundle.
Oh, thank you. That's
sweet.
Very kind.
Thank you very much.
Yeah, I love these things because you know what? One of the things. Full disclosure, Tom and I had a viewing party of a Brian Johnson thing one time, and we weren't. Not all of it was not making fun of Brian Johnson.
He looks like Data from the Star Trek series.
Yeah. So look, we could poke at people a little bit, but one of the things that I do think he's opened up is that if you have a plan and you just follow it, he goes through his kitchen counter. And granted, he's got a team, an army of people that are laying the supplements out and doing the thing, but he literally just walks down the counter and does the next thing. Here's the next fistful of shit I got to take. Here's the hat I got to put on. Here's the cream I got to do. It's just ding, ding, ding. He's not thinking about it. It's not even in his radar. And I'm like, you know what? That concept is very interesting. And I think what you guys are doing is very similar. It's you know what? Here, we're going to give you, once we get it going, you're going. You don't have to think about this. It's very
measured.
Shall I say minimally invasive, right? It feels like. I mean, you guys correct me if I'm wrong.
It's actually kind of funny. I mean, he is a person who can follow, basically not think about it. Let the algorithm define. I've met him. I think he's very genuine and has good positive motivation on this. I think that, the stuff that gets suppressed is not necessarily, who he is. And we have had patients in our practice like that. Actually, we do better with people who have more personal preferences. It's like, we had this one guy, he was like, I don't really think I can do your program because my wife is a great cook and I love to eat. It brings me joy in my life. And I was like, that's beautiful. You know what I mean? Like, don't change your diet at one bit. Let's do other things because there's other things you can do. And maybe down the road, you want to change your diet. We can help you with it. But really finding that automatic plan that you enjoy.
Right.
That you can be like, feel good about, like, this is bringing me joy in my life versus, and there are some people like Brian who can just blindly follow it. And we have had some people like that in our practice. And then, we're like, giving every down to the gram of what you should be eating and down to the minute of what you should be doing in the gym and all this. But most people want something that's a little bit like actually a lot more flexible and a lot more driven by their own personal preferences and lifestyle. And that's where I think the magic can really happen. We can do it in our clinic. I think AI can deliver that sort of experience. But I agree with you, Matt, that's what people need is like a very specific plan, but it has to be customized to like how many trade-offs are you willing to make and what's going to, make your life worth living. Like I mentioned, the people who say, I have to have wine in my life or why am I even alive? And I can appreciate that. Brian clearly doesn't feel that way. He doesn't need wine in his life to feel alive. So, and there are plenty of people on that spectrum too. So it's really finding that balance in your life becomes really important.
And it's funny, you mentioned the guy my wife is a great cook and I like to eat. The reality is if his wife is cooking every day, he's probably eating
healthier than most people.
You know what I mean? Like it's unlikely unless she's just like a real big fan of heavily breaded, fried food.
Yeah.
Like it's unlikely that he's not already at least in the zip code of healthy, right? I mean, it's
for sure.
I mean, look, I had a conversation with a guy not that long ago where he was like, basically like, go to the grocery store and don't leave the produce aisle, cook and then go to the meat aisle after that. Mm-hmm. And if you could leave there and just cook every day or most days, more days a week than not, like you don't even have to care what you're eating. Like just vegetables, lean protein, step and repeat. Like just, it doesn't matter. What's the difference between olive oil and avocado oil? Who cares? You're eating fine. Like, like if you want to dial it in and get more specific, we had guys on the show that have a whole thing about seed oil, right? Everyone on the planet's talking about seed oil now, right? So you could always hone the edge, right? And do more, but like generally speaking, this guy's probably doing
Start with whole foods.
Yeah, right. Exactly.
Don't go eating the French fries and beef tallow. That's not going to be healthy. Or the cereal without red dye is still unhealtly.
It's funny. You crack me up.
You mean taking the red dye out didn't make America healthy again?
Yeah.
No.
Right. But like when I played with paleo like years ago, and like as soon as you start doing paleo research, you find out that everything's like a substitute for some shitty food in non-paleo land. It's like use almond flour or tapioca flour or something. I'm like, to make your cookies. I'm like, wait a minute. The whole point of eating paleo was to like kind of dial in a health situation. Why the fuck am I making cookies? Like,
exactly. And it's seed oil is the same thing. If you eliminate all seed oils, you're not going to eat any processed food because like most of the heavily processed food is made with seed oil.
Cheap seed oil.
Going and substituting it with something else, and then you sort of miss the point. It's
totally. Yeah, it is kind of funny, but so guys, where do we send people again, just so we get the AI to
wrap it up one more time because we did all the socials and everything.
longevityhealth.me, longevityhealth.me.
It's all roads point to
all the information is there. You can see the Billionaire Bundle. And if you're interested, we are in a private beta for our AI product. It starts at $99 a month. If you're interested in that, you can find, just contact us on that page. You can find me on LinkedIn, Jesse Levey. I post there. We also have a newsletter that you can access on our website, and we do a longevity guide. So it's a series. you sign up for it, and it goes through some of the stuff that we talked about.
Oh, it's awesome. Yeah, I love that. And we're going to be posting up all that stuff to our show notes here, and we'll get you guys dialed into all that. But yeah, we love it. I thank you so much for spending some time with us.
Thank you for taking the time, guys.
Yeah, it's very cool.
Thanks for having us.
All right. Well, guys, enjoy the weekend. Try to do something healthy, I guess, right? Take care.
Be subversive, irreverent.
Health is wealth, but you knew that.
Everybody knows that.
But so is following us on social media at Irreverent Health. And check out our website for more exclusive content at irreverenthealth.com.
Oh, I like this.
Thanks for tuning into this episode of Irreverent Health.